Hello friends, welcome to CNS Viewpoint. Today we are going to talk about a very interesting study shared by Dr. John Campbell in one of his broadcasts in early January 2022. And this study was about looked at how people who were infected with the common cold coronavirus and the antibodies which develop because of the coronavirus that causes common cold, will they have any protective effect in people who get infected with COVID-19 coronavirus? So interestingly, it was found by the researchers that yes, the common cold coronavirus, when it infects people, then it is likely to have some protective effect on them if they happen to get infected with the COVID-19 coronavirus. And they also found that it is true for all age groups, comorbidities, etc., which means that people who had so for example, a person of 80 years of age, 90 years of age, who will, and with some comorbidity, will and who has antibodies for common cold coronavirus, will have some protective effect compared to a person of similar profile, so age-wise, disease-wise, etc. So it was quite an interesting study to see that how different coronaviruses and the antibodies which our human bodies develop against them are also having some protective effect on diseases caused by viruses that are somehow similar in some ways. So just like coronavirus, so which is good. So, but again, these are very initial studies. Nothing is 100%. The only thing which we must remember is that we have to break the chain of coronavirus infection transmission, and we know how to break the chain of infection transmission. Wear a mask properly, covering your nose and mouth, and wear it with clean hands. Maintain social distancing or physical distancing. Wash your hands. Keep sanitation and hygiene. And if you feel sick, please self-isolate, get tested, and get all possible care. Clinical care pathways are extremely important, and linkages to those pathways. And government's role is extremely critical here, because without social support and social security and all kinds of support, how will people make choices, healthy choices, health-seeking choices for themselves and for their loved ones? So governments, you really need to buck up, because they are making measures, they are taking measures which are even more regressive and putting people more at risk of getting infected. So for example, the services for COVID-19 related comorbidities took a backseat during lockdown, when we know these are the services depriving people with comorbidities of healthcare services, such as for diabetes, hypertension, heart diseases, cancers. They will put people more at risk of severe COVID-19 and death related to COVID-19. Also, risk factors associated with these comorbidities. If governments will not pay heed to risk factors, controlling those risk factors, then we will see adverse effect. And during the lockdowns in India, among the first shops to remain open or reopen were tobacco and alcohol. So it was very interesting for me, because the city where I was in during both lockdowns earlier in Lucknow in India, So there was specific timing when I can go to purchase essential food, etc. But alcohol shops were open from morning to evening. Amazing, really. And this is when there was enough data at that time. Also, we wrote an article which got published in several newspapers and magazines and online portals in different countries, that compiling all the evidence which from World Health Organization and other experts and other publications, scientific publications, making a case that tobacco and alcohol are associated, known, proven risk factors for a range of comorbidities which are associated with COVID-19 serious outcomes and death. So let us hope more sense prevails. Let us hope science takes science and evidence guide policy decision making and programming at every level and step. And social support and social security goes hand in hand when we are trying to deliver on health security. With these words, I will conclude today's CNS Viewpoint, and we will be back again tomorrow at 5 p.m. India time with our thoughts and views and perspectives on something that made us think. Bye till then, stay safe, and keep watching CNS Viewpoint daily 5 p.m. India time.